Percutaneous repair or medical treatment for secondary mitral regurgitation. Severe secondary mitral regurgitation is a predictor of poor clinical outcomes in patients with heart failure and reduced left ventricular ejection fraction.
It's important to remember when we're talking about mitral regurgitation that when the blood is going backwards into the left atrium, there are no other valves between the left atrium and the pulmonary bed. So the pressure that is in the left ventricle essentially becomes reflected back into the pulmonary bed. Normally the pulmonary bed pressures are very low compared to the body pressures. So the normal body pressure, which is 120/80, which is what we normally refer to, the arm pressure, the lung pressures will be normally 20/10, 20/15. So if the mitral regurgitation is severe and there's much leakage, that will clearly impact the severity of the pressures and elevate the pressures. And that, in essence, is what begins to cause people to have shortness of breath, is that their pressures are too high in their lungs.
Application in nutrition. Follow a heart-healthy diet. Feeding does not directly affect mitral valve insufficiency. Despite this, a healthy diet can help prevent other heart disease that weaken the heart muscle. Eat foods reduced in saturated fats and trans fats, sugar, salt, and refined flours, such as white bread. Eat different fruits and vegetables, whole grains, and proteins, such as lean meats, fish, and nuts. Pros: mortality reduction. Reference centers in valvulopathies with estimated success rate in mitral valve repairs are higher than 95%. Cons: occasional chest wall instability, sacrifice of the right internal thoracic artery, occasional difficulty with aortic valve exposure, and difficult conversion to median sternotomy.
Unlike traditional mitral valve repair surgery in which the sternum is cut 10 centimeters and spread open, in endoscopic mitral valve surgery, the surgeon cuts open only a basic 5 centimeters below the nipple, and only 2 tiny incisions are made through which the surgical instruments and camera access. The tiny camera provides with a view of the diseased valve. The diseased or damaged valve is either oversized, misshapen, or it doesn't close properly, or it is too narrow, which allows blood to leak backwards, causing defect, leading to malfunctioning of the heart. A repair is necessary for the damaged portion. We remove the misshaped portion of the valve. Reconstruct it with sutures. We insert an artificial ring to reduce its size. We sew the ring into place, and the valve now closes properly and the blood no longer leaks back. After the procedure, only a few tiny scars remain, instead of the 6 to 18 scars in the middle of the chest associated with traditional heart surgery.
Prognosis in patients with heart failure and secondary mitral regurgitation is poor, although surgical mitral valve repair and replacement have not been shown to reduce hospitalizations or death. Transcatheter mitral valve repair may improve clinical outcomes. In this multi-center randomized controlled open-label trial, 614 patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remained symptomatic despite maximal medical therapy were randomized to transcatheter mitral valve repair plus medical therapy or to medical therapy alone. The primary efficacy endpoint was all hospitalizations for heart failure within 24 months. The primary safety endpoint was freedom from device-related complications at 12 months. A key pre-specified secondary endpoint was all-cause mortality within 24 months. The annualized rate of all hospitalizations for heart failure within 24 months was significantly lower in the device group than in the control group. At 12 months of follow-up, 96.6% of patients in the intervention group were free of device-related complications, exceeding a pre-specified threshold. All-cause mortality within 24 months was lower in the device group than in the control group. The authors conclude that among patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy, transcatheter mitral valve repair may improve clinical outcomes. Full trial results are available at nejm.org.
Statistics. The rate of death or unplanned hospitalization for heart failure at 12 months in patients with severe secondary mitral regurgitation has been reported to be as high as 50%. Data from the pilot European Sentinel registry involving patients with severe secondary mitral regurgitation who underwent percutaneous mitral valve repair indicate that the rate of death or unplanned hospitalization for heart failure at 12 months was approximately 33%.
Hey, it's Dr. Gonzo, and you're watching In a Nutshell. Today I was going to talk to you about how do we manage patients that have mitral valve insufficiency due to functional mitral insufficiency. Now remember in one of the previous videos I talked to you about what functional mitral valve looks like. In that situation, the walls to which the mitral valve attached to has stretched out, causing the mitral valve to shift from this point to this point, allowing for a gap to occur between the two leaflets of the mitral valve. What that means is that blood, rather than moving in this direction, blood starts leaking back to where it came from, which is the left atrium and the lungs, causing conditions like we call congestive heart failure. Now the solution for this type of problem is kind of a simple one. What we do is we put a belt around the mitral valve. Now this is the mitral valve as you would see it in a surgical view. And what we do is we put a ring and suture it around the mitral valve annulus. That's like a belt. It sort of brings everything back together so that way, instead of the valve being stretched out like this, you reestablish the normal geometry of the valve, allowing for the mitral valve leaflets to kiss again. And that's functional mitral valve repair in a nutshell. Thanks for watching. See you in the next one.
In my personal conclusion, keeping a healthy weight within the limits recommended by the doctor, following a healthy diet that does not include salt and saturated fat excess, and also performing physical activity on a regular basis depending on the severity of the condition will help to prevent other heart disease that weaken the heart muscle or worsen the disease that they already have.